Rural America is in a crisis. A spike in suicide and death by substance abuse has strained communities already struggling with a lack of clinical and inpatient resources. But there is hope. Led by their local health systems, two rural communities in Colorado and North Carolina have rallied to meet the challenge, and they're changing the fortunes of those that live and work there. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly with AHA Communications. In this two-part series, we learn how two rural communities are developing new and innovative solutions to build capacity for behavioral health services. Part 1 deals with solving the Paradise Paradox and stemming the surge of suicides in Eagle River Valley, Colorado. Part 2 is the story of how navigating a complex bureaucracy increased the inpatient psychiatric bed capacity of a critical access hospital in New Avery County, North Carolina. In today's Part 1 podcast, John Supplitt, Senior Director of Rural Health Services with AHA, and Jordan Steiger, Senior Program Manager, AHA Clinical Affairs and Workforce, start the discussion with some alarming statistics about the prevalence of mental health issues, including thoughts of suicide, in many rural communities. Later on, they are joined by Will Cook, President of Vail Health in Vail, Colorado. Let's join them.
Good day, I'm John Supplitt, Senior Director of Rural Health Services for the American Hospital Association. I'm joined by my colleague Jordan Steiger, Senior Program Manager, AHA Clinical Affairs and Workforce. Welcome, Jordan. Can you give us a little background on our topic?
Of course, and brace yourself for some staggering statistics here. A recent survey by the Substance Abuse and Mental Health Services Administration, or SAMHSA, shows over 20%, or approximately 7.7 million rural adults report having any mental illness in 2020. In addition, 1.8 million, or 4.8% of adults in rural areas reporting having serious thoughts of suicide during the year. This is a crisis of enormous proportion and one that requires new strategies to address the growing demands of those living in rural America.
Thank you, Jordan. Indeed, those are shocking numbers that demand our attention. To address our concern regarding the incidence of mental illness and our capacity to treat it, we will present a podcast in two parts. In part 1, we will hear from Will Cook, President and CEO of Vail Health, Vail, Colorado, which serves Eagle and Summit counties in Colorado, where residents and healthcare providers were confronted by a surge of suicides and the need for an immediate remedy. In part 2, we'll hear a story from Stephanie Greer, President, Cannon Memorial Hospital, an Appalachian Regional Behavioral Health Hospital in New Avery County, North Carolina, where Appalachian Regional Healthcare acquired an unprecedented waiver in Medicare conditions of participation to expand the inpatient capacity for psychiatric services in the community. But let us begin with our first case example, as told to us by Will Cook, President and CEO of Vail Health, Vail, Colorado. Will, thank you very much for sharing your story with us.
John, thank you for having me, as well as for sharing the story, because as you said, this is a national crisis that requires all of our attention. And here in the Rockies, where we've been labeled as part of the suicide belt, or in particular in some of the mountain resort communities, the Paradise Paradox, we saw a disproportionate share of people with mental and behavioral health issues, including substance abuse disorder. So much so that we at one point said, we've got to do something about this.
Well, as I understand it, healthcare leaders from two neighboring counties in rural Colorado formed two separate grassroots movements to improve access to behavioral health. What was the motivation behind this effort?
In September of 2017, the Eagle County Commissioners called for a ballot issue asking voters to authorize a new sales tax and a new excise tax of up to 5% each on recreational marijuana. The purpose of that was to fund mental and substance abuse services. In November of that year, the ballot issue won in a landslide, with more than 73% of voters supporting the tax. It was clear that Eagle County voted to save lives.
Well, describe for us then the approach taken by Eagle County to garner such robust support for a new sales and excise tax. Who led this effort and how was it rolled out?
First and foremost, it's imperative to know that the secret to dealing with this is having collaboration from everyone in the community and leveraging federal, state, local municipal dollars, as well as looking to other nonprofits to have us all come together and figure out ways that we can address the crisis. And to align the needs of the county and manage a plan for capital, accountability, and fundraising, a backbone organization is essential. To that end, Eagle Valley Behavioral Health, a wholly owned subsidiary of Vail Health, was established to lead the community alliance and to ensure access to superior behavioral health services for everyone from Vail to Dot Zero, which is known as the Eagle River Valley. In April of 2019, a plan was presented to the board of Vail Health, and board members unanimously voted to commit $60 million over the coming decade to support behavioral health efforts. In addition, the board also challenged our foundation to raise an additional $100 million over the following 10 years. I'm pleased to announce that in just 2.5 years, we've already raised $59 million, of which more than 20% has gone to non-Vail Health nonprofits within the community. The point being, you must actually ensure that all organizations have access to these resources, and you must have a backbone organization to help lead the cause.
Well, that is a significant contribution to a very serious cause. Tell us then, what was the outcome of this effort?
Well, I'll tell you, first and foremost, we had 6 different strategic pillars for the project, one of which was adding much needed behavioral health providers in our community. In fact, we've increased the number of behavioral health providers by 50%. Now, this just isn't psychologists or psychiatrists. It's also behavioral health therapists. It's also licensed social workers. But in addition, we made sure that we were integrating these things into primary care and into the schools and into the jail. We also created a crisis co-response system that really allowed behavioral health professionals to respond to a behavioral health crisis so that it wasn't just falling on the shoulders of our law enforcement. We also made sure that we were working on ways to overcome the stigma. We created a website to enable people to find what services they needed and how they could provide it. And we were pleased to actually receive the designation as a community mental health center. That was a year-long plus process. And it was Colorado's 18th community mental health center and the first one that's been done in 40 years. But I would say above all, since we've all leaned in and added more behavioral health providers and put them in schools and put them in primary care and really tried to get upstream to the problem, we've actually started to see some of those statistics that were so alarming drop off, including the number of people who get transferred to our emergency department for an M1 hold, including the number of adolescents who had contemplated suicide. 25% prior to this intervention even had made a plan of some sorts for it. And we're so pleased now to see some of those numbers dropping off, which during a period of a worldwide pandemic where behavioral health problems got worse, we're really, really glad to see this, but we still have a lot of work to do.
Well, what really impresses me with the 6 pillars approach, it's multidimensional, multifactorial, but it had to take a significant amount of strategic planning from across these groups that were engaged in this effort. Tell us a little bit about how you coordinated this strategic planning across the communities to achieve the goals that you're achieving.
Well, first and foremost, we wanted to make sure that every municipal government, primary nonprofit organization, healthcare provider was represented. And we required that whoever showed up to the meeting had to have decision-making authority. Not that they had to go back and get permission, but they had the ability within the meeting to make decisions. And then we empowered that group. They met on a regular basis. Initially, it was bi-weekly. Then it went to monthly. We now meet on a quarterly basis now that we have Eagle Valley Behavioral Health in place to help sort of administer this thing. But suffice it to say that you have to include everyone for the community. You need to have decision makers in the room. We hired an outside consultant to sort of lead the conversation and help us with the strategic plan. But that system mapping and gap analysis involved over 50 community partners, 50. And I know at times that might seem overwhelming because you're thinking, how do you control a group of that size? But it's really, really important. And through that process, we identified issues. We had system leader interviews and multiple workshops engaging community organizations. We described 20 unique gaps across the behavioral health continuum. We held design workshops and system leader sessions to help define high priority initiatives addressing all the gaps. We engaged 53 people via 5 group workshops and one-on-one discussions to determine costs and make sure that there was a cost benefit and that we weren't coming up with solutions that were more aspirational than attainable. We developed a collaborative fundraising strategy to ensure that no one was being left behind and that we weren't competing for the same limited resources. And as I said earlier, of the $59 million raised, more than 20% has gone to non-Vail Health entities. And then finally, we launched the collaborative fundraising effort as well as the system transformation, including the launching of Eagle Valley Behavioral Health, all in parallel. We do everything transparently. We created a board for Eagle Valley Behavioral Health. It's comprised mostly of community leaders and not just Vail Health folks. So in my mind, it is a grassroots, ground-up effort that must include all the key leaders in the community, but you do need a healthcare provider that serves as the backbone. And you definitely want to make sure you're leveraging federal dollars. HHS is now doing things to address behavioral health. You want to leverage state dollars. Our own governor in the state of Colorado started an Office of Behavioral Health and has committed millions of dollars to it. And you definitely want to leverage all the local resources that you possibly can.
I think really what's fascinating is how the foundation of this effort is truly a grassroots contribution from across the communities that are involved, both in Eagle and Summit counties. Tell us a little bit then about the relationships between the counties and how you were able to build those bridges.
Well, first and foremost, again, as I may have mentioned earlier, that collaboration starts as a local thing. And for us, that was in the Eagle River Valley, the area from Vail down to Gypsum and Dot Zero. But because so many of our patients, our workers, our providers, guests permeate across our valley from, say, Summit County, where Breckenridge and Keystone and Copper Mountain are located, we realized that we needed to collaborate with counties that were adjacent to us. Again, coming back to that suicide belt or that paradise paradox where we were seeing higher than state average behavioral health statistics that were so alarming, part of it's related to the fact that we're just so isolated. And it's so hard to have enough behavioral health providers here and other services here because it costs a lot to live here. Housing is a problem. Daycare is a problem. There's less real estate that you can develop because we're on the side of beautiful mountains. But when you factor that in with so many people moving here and leaving behind with them their families, their friends, their support systems, it created a perfect sort of storm. And I think that's why we were seeing a disproportionate share of the problem. And it really made us realize we need to collaborate with the counties that are next to us and share shamelessly all the things that are working and the things that are not. And we were so pleased to see that Summit County, its own municipal governments, its own leaders, its other nonprofit organizations had kickstarted the Building Hope initiative, which now receives support from the Summit County government and many other nonprofit agencies, thousands of residents. And like in Eagle County, Summit County leaders are trying to figure out where do they find funding for this and how can they put taxable measures on the ballot. Honestly, from my perspective, it's so easy to get overwhelmed by what's going on in our world and in particular with behavioral health. But if you put a positive view on this thing, you have to think that now more than ever, given this is a worldwide issue exacerbated by the pandemic, given it's a nationwide issue, a statewide issue, and there's not a community or a family or anyone who's exempt from this, now more than ever, I think there's going to be funding from the federal government, funding from the state government, tax initiatives. I've even found that socially aware private investors are interested in getting into this space. So do not allow the lack of funding to scare you away from doing it. Instead, bring everybody together and show how you are being very careful and thoughtful about using those resources, and then you'll increase your chances of getting them.
That's a fantastic recommendation. And as a result, we're seeing that you're making huge strides to address the need. Help our listeners understand what lessons you learned along the way towards creating Eagle County Behavioral Health that would be important for them to know when they start their own project.
My pleasure. And I'll share two. First, don't wait. I would act fast. I would treat this like the crisis that it is. A lot of people are saying that COVID was the healthcare crisis of our lifetime. I disagree. It's behavioral health. COVID, of course, exacerbated it, But waiting has led to the significant crisis that we're seeing in many of our communities. Don't let the fear of getting started or feeling overwhelmed stop you from taking action. Pull together a group that involves some of the constituents you heard me say earlier. Get some momentum. If something is better than nothing, don't let perfect be the enemy of good. The second thing I'd say is we found that one organization or even a handful of organizations can't be successful in doing everything. There's many different existing organizations that have their own missions, play an important role in all of the things that are necessary to do this. Do not think that you need to take this on yourself. You will fail. If you don't have everybody involved and leverage all of those magnificent skill sets and resources, you'll set yourself up to fail. But I will say this. I think by combining your assets and sharing resources, and again, starting immediately, and then saying, hey, let's leverage everybody in the process and not let one or two organizations try and take it on all themselves, you will find yourself looking over your shoulder in 12, 18, 24 months in a much better position than you are today.
Well, it's really very clear that the story behind this is very inspiring, and I really believe that it's going to get a lot of traction among those who listen to this podcast and carry forth the knowledge that they've learned from this to their own situation. I want to thank Will Cook, President and CEO of Vail Health, Vail, Colorado, for sharing this really important story with us. Innovation is often born from crisis, and the urgency here may be suicide prevention, but it is one that has festered over time and shows a need to fill a prolonged gap in care to the residents of Eagle and Summit counties and across rural America. But these objectives are never achieved in a vacuum. On the contrary, strategic partnerships like the one between Eagle Valley Behavioral Health, Building Hope Summit County, Vail Health, and the dozens of other stakeholders that cut across the care continuum enable rural hospitals and health systems to improve access and advance the health of their communities. It is clear in this case that success is being driven by inspired leadership, forward-thinking governance, and resilient clinicians and staff. In part 2 of this two-part podcast, my colleague Jordan Steiger will interview Stephanie Greer, President Kennan Memorial Hospital, an Appalachian Regional Behavioral Health Hospital in New Avery County, North Carolina, where Appalachian Regional Healthcare acquired an unprecedented waiver in Medicare conditions of participation to expand the inpatient capacity for psychiatric services in their community. Until next time, thank you for listening. This has been an AHA Advancing Health podcast.